Hey guys, what's up? This is Dr. Marcy, and I just wanted to do a quick video and talk to you about inflammation and pain in your body. Is that for sure that pain is based on inflammation. And inflammation can be looked at in a couple of different ways. One of the ways that it can be looked at is that local inflammatory response that comes from a direct trauma type injury. And one of the ways that it is looked at often is from the standpoint of being long-term chronic inflammation. And chronic inflammation, when we're talking about what happens in the body and the body systems, is inflammation that has persisted for longer than about 6 weeks. And that inflammation is really detrimental to your body overall. And what happens in those times when you're in those stages of chronic inflammation is deterioration. So our goal is always to have the least amount of damage done to our body at any given time. And the things that cause chronic inflammation are actually ourselves. Inflammation that is chronic comes primarily from not getting the right nutrients, not getting enough sleep, and having too many negative impacts on our life that we can't detox from, essentially. And that detox can be a lot of different things. It can be your cell phone, it can be alcohol, it can be cigarettes, it can be exposure to sunlight, it can be different things in your environment. But number one thing that you can do to improve inflammation in your body is your nutrition. Your nutrition plays such a key role in how your body functions, and your gut in particular plays the most important role there. There are several studies coming out now that are very valid and reliable studies that talk about inflammation in the gut, or leaky gut, or gut microbiome imbalance, that actually prove that what we experience in the clogging up of the GI tract actually leads to poor health. And that's not just your health in general, that's even mental health. So the brain fog or forgetfulness, Alzheimer's, bipolar disorder, even schizophrenia symptoms can be amplified by a poor gut balance. So it's really important to continue to look at all of these things in our daily life and help restore our gut health first, and not just worry about what's happening in our day-to-day diet. So another thing that a lot of people don't like to talk about, but we should, is bowel movements and bowel function. So you should be having 2 to 3 bowel movements a day. They should be fairly soft and easily passable, and they should be about the firmness of a not quite ripe banana at hardest, and ripe banana at the softest. Anything outside of that is considered abnormal, and a lot of people will talk about normal for you, but truly anything outside of that is abnormal. So if you have stools that are looser than that, that probably means that you're not digesting your fats as well. And we do need those fats for nutrition of our nerve tissue and our organs. And if you're getting anything harder than that, that means that your body is really not getting, number one, enough water. And number two, it's not able to absorb the nutrients out of the food that you are getting. And so you're going to have more inflammation. A lot of people say just go take a probiotic. But I don't think just taking a probiotic is the answer. You need to really focus on improving the health of your gut overall. And sometimes that'll occur with taking a probiotic, sometimes just by changing your diet. But changing your diet and taking a probiotic will take longer overall if you're not getting exactly what you need. So a stool sample test can be a great tool to helping you achieve success in resetting your gut health, and therefore resetting your overall health, and therefore reducing inflammation in your body and reducing pain. If this information is helpful to you at all, please like and share this video and tag one of your friends in it. And remember, 2 to 3 bowel movements a day that are somewhere between a unripened and ripe banana in texture and thickness or firmness will really be a great determining factor in how much inflammation you will have in your body long term. I hope you have a great rest of the week.